In HealthWorks, as we get into the hot summer pool season, a very serious stat to share with you. Drowning kills more kids between the ages of 1 and 4 than just about anything else. And for that age group, it usually happens in a home swimming pool or spa. So this might seem like simple common sense advice, but pool safety can be life-saving.
Here's the serious side of summer fun. Every year, just under 4,000 people die from drowning. That's an average of 11 drowning deaths every day, according to the CDC. An emergency physician from University of Michigan Health says it's important to know what drowning actually looks like.
The notion that someone may be flailing or splashing or calling out for help is really not that common if someone's drowning. In the cases that I've seen over the last couple of decades in emergency medicine, oftentimes people may just slip below the water without a sound, without any obvious signs of distress. And in the cases where people have been successfully rescued, it was because the people around them were vigilant. They happened to notice that the person wasn't swimming as they normally were. They were underwater longer than they had been previously. And those were those cases where people were able to successfully rescue them because they were so vigilant about how people were swimming and that this was not normal.
Children are a group at greater risk of drowning, and for every child who dies from a drowning, another 8 require emergency care for non-fatal drownings. The doctor says parents need to be vigilant about supervising kids in the water or assign a designated water watcher to keep an eye on kids with no distractions.
If they were to fall into the pool or fall into water, know how to tread water, how to get themselves to the surface, how to tread water for a period of time so that they can be rescued. And also just being able to swim at least a certain distance and understand in their environment, where are the safe places to get out of that water? Where are ladders? Where are stairs? Where are the shallow spots that they can get to if they were to fall into water? That's not a substitute for very careful supervision and flotation devices, but having that just-in-case emergency awareness and those basic skills can absolutely be life-saving.
Remember, you can rarely hear a child drowning, so think about installing alarms, either on a house door that leads to a pool or maybe a floating alarm that stays in the pool. And keep toys out of the pool area, out of the water and out of the surrounding area, because curious toddlers can sneak through a fence to get to those toys. That's HealthWorks. I'm Dina Santafanti.